Assalamualaikum warahmatullahi wabarakatuh. Welcome back to my video. And so this time in this video I will present about a material which is about the expressions that you can use to ask and give suggestions. And the topic of my presentations is about the coronavirus. So let us start. Good morning everyone. How are you doing? I hope all of you are doing well. This morning I will talk about the coronavirus. The coronavirus is a virus that attacks our respiratory system. In most cases, it only causes mild or moderate infections. But this virus can also cause severe respiratory infections such as pneumonia, MERS, Middle East Respiratory Syndrome, SARS, severe acute respiratory syndrome, and Edwards death. Everyone can be infected with the coronavirus, but babies, children, and people with weak immunity are more susceptible to infection with the coronavirus. How this virus is transmitted? This virus is transmitted by direct contact with respiratory droplets from infected people. When they cough, sneeze, or talk. But it could also transmitted via contact with surfaces that contaminated by respiratory droplets such as door handles, our smartphones, ATM machines, keyboard on your laptop, and others. But simple disinfectant can kill this virus. And what symptoms will you experience if you are infected with the coronavirus? There are some common symptoms that can indicate a person is infected with the coronavirus. The symptoms can include fever, cough, and shortness of breath. Okay, now I will give you some tips to prevent coronavirus from infecting us. And also I will give you the expressions that we can use to ask and give suggestions. The first one is you can use what should I do to ask suggestions, and you can use if I were you I would blah 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 when you want to give suggestions to someone. For example is, because this topic is related to the coronavirus, so the example is about the coronavirus. I don't want to be infected with the coronavirus when someone sneezes or coughs. So what should I do? And the suggestion is, if I were you, I would wear mask every time I have to go out. Choose a mask that has 2 or more layers of washable and breathable fabric, and make sure it completely cover your nose and your mouth and fit snugly against your face and doesn't have gaps. And be sure to wash your hand before touching on a mask. Don't wear a mask on your neck or on your chin. And the second one is, you can use, do you have some ideas when you want to ask suggestion? And you can use you had better when you want to give suggestion to someone. For example, coronavirus can survive on surfaces for several hours. Do you have some ideas or do you have some tips for me so I can prevent it from infecting me? The suggestion is, you had better wash your hand frequently using soap and water at least 20 seconds, or use a hand sanitizer that contained at least 60% of alcohol, especially after doing activities outside or in public places. Do not touch your face with unwashed hand. Always cover your mouth and nose with a tissue when you want to sneeze or cough, and use the inside of your elbow and try to do not spit. Avoid close contact. Put 6 feet between you and the other people. Clean and disinfect frequently touched surfaces daily. This includes table, doorknob, keyboard, your phone, and the others. And the third one, you can use the expressions of what do you think I supposed to do when you want to ask suggestion to someone. And you can use you should when you want to give suggestion to someone. For example, what do you think I supposed to do if I have no symptoms but I feel I have been exposed to corona? And the suggestion is, you should stay at home for 2 weeks and limit contact with other people. And if symptoms appear, then do self-isolation and contact the nearest hospital via your smartphone or via your cell phone. If you need a direct examination by a doctor, don't go to the hospital immediately, because that will increase your risk contracting or transmitting the coronavirus. You can make a consultation appointment in advance. Okay, maybe enough for my video. Thank you for your nice attention. Assalamualaikum warahmatullahi wabarakatuh.